In modern emergencies, we expect sterile care, pain relief, and skilled paramedics. Comfort is a priority, but on ancient battlefields, survival was brutal and immediate. There were no clean tools, no painkillers, and no time for gentleness. For a Roman, Viking, or medieval knight, the only goal was to live through the chaos. Ancient medics, often just fellow soldiers, had to act fast, with little knowledge and fewer resources. The enemy was not just the wound, but time, infection, and the battle itself. Every second spent on comfort risked a life. Today, we minimize pain. Back then, they fought to stop bleeding in the mud. A screaming soldier was alive. A quiet one slipping into shock was lost. Their harsh reality prioritized survival over comfort. A mindset with lessons for anyone facing emergencies far from help. The ancient approach: act fast, accept pain, and do whatever it takes to survive. On ancient battlefields, the clock started the moment someone was wounded. Catastrophic bleeding and shock killed within minutes. Speed was everything. Medics jammed cloth, moss, or even dirt into wounds to stop bleeding, ignoring comfort. Removing arrows was brutal. Push it through or yank it out, pain be damned. A wounded soldier was a liability. Treatment had to be fast so they could move or escape. There was no time for careful procedures. A quick splint or bandage was enough. Resting was dangerous. Staying still meant becoming a target. Medics prioritized getting soldiers moving, even if treatment was rough. The urgency was both medical and tactical. On the battlefield, comfort was a luxury. Speed and action meant survival. Quick, imperfect care saved lives. Hesitation did not. Today we fight pain. Ancient medics saw pain as proof of life. A conscious, hurting soldier was still fighting. Pain meant the body hadn't given up. Painkillers were avoided. Dulling the senses risked unconsciousness and death. Staying awake was critical. Shock and sleepiness were enemies. Agonizing treatments like cauterization kept soldiers alert and alive. Enduring pain was a mark of strength and survival. Medics needed the wounded to be alert, able to help in their own rescue. Comfort could wait. Staying alive came first. Ancient battlefield medicine was about speed and improvisation, not cleanliness. Medics used whatever was at hand, dirty cloth, moss, spider webs, to stop bleeding. Infection was a later worry. Bleeding out was immediate. Wounds were stitched with coarse thread and crude needles. Neat scars didn't matter. Cauterization, pressing red-hot metal to wounds, was common, agonizing, but effective. Amputations were fast, brutal, and done with basic tools. The stump was cauterized or plunged into boiling oil. Survival depended on decisive, rapid action, not surgical skill. These methods seem barbaric, but they saved lives. Ancient medics improvised, prioritized threats, and acted without hesitation. Their brutal art was born of necessity and saved countless lives. Ancient battlefield medicine offers vital lessons for modern wilderness survival. When far from help, you must act fast. Stop bleeding immediately with whatever you have. Forget perfection. A quick, imperfect fix is better than waiting for the ideal solution. Splint with branches, use a shirt for pressure, improvise and act. Keep the injured person alert. Talk to them, monitor their state, and fight off shock. Survival is about courage, quick thinking, and decisive action, not comfort. The ancient rules still apply. Stop the bleed, keep them conscious, improvise, and move fast. These aren't just old stories. They're a guide for anyone facing real danger. When it matters most, speed and action are your best weapons.